Ear infections is one of the most common childhood illnesses there is in the entire world, so it's extremely common, but they should be very infrequent and should be easily treated with antibiotics. However, those kids that are extremely prone to it and their infections are happening over and over again, we have a certain number at which point we feel that, and our criteria is that they're better served to have tubes in their ears than they are to just be on repeated medication. So we usually say that if a child has had more than four ear infections in a 6-month period of time, uh, putting tubes in will help mitigate this because the tubes provide the ventilation that is making the ear susceptible to these infections to start with. So we have a balance with that. We don't want to put tubes in if we can just treat 1 or 2 infections a year. But at some point, it is better off to have the tubes in to avoid the frequent unnecessary use of antibiotics.